Hello, my viewers. I welcome you all back to my channel, Time with Nurse Joycelyn. Today's topic is hypertension. We are going to talk about hypertension and everything that concerns it. Yes, if you are newly diagnosed with hypertension, this is for you. And if you are already taking medications for it, we are going to dive into strategies that will help optimize your treatment. Those of us who are also looking for natural ways by which they can prevent hypertension, this is equally for you. We are going to dive deep into all those strategies that will help us curb this situation. Stay tuned. So, if you are new here and you are now joining the family, kindly subscribe to this channel, like and share my videos, and also put on the notification bells for new updates. First of all, I would like to congratulate every member, every subscriber of mine who is battling hypertension and are already on medications. I would like to tell you that you are doing well. You have to continue. Just know that it's not easy to fight hypertension, but it can be easy with how you try to manage it, how you decide to manage it. I would want to tell you that you are not alone in this journey and that every small step you make towards the fighting of hypertension counts a lot. Yes, it does count a lot. High blood pressure or hypertension is simply a medical condition whereby the blood pressure from the arteries are consistently elevated. Yes, arteries are blood vessels that carry oxygenated blood with oxygen to all parts of the body. The artery supplies the body with oxygenated blood. So the pressure with which the arteries pumps blood to all parts of the body, if it becomes higher, if that pressure becomes higher, that is what we term as high blood pressure. We also have veins in us, but veins are concerned with the transport of deoxygenated blood without oxygen, back to the heart for oxygenation. So this cycle goes on and on and on to make sure we are alive. Whilst arteries carry oxygenated blood to all parts of the body and other organs, veins carry the deoxygenated blood without oxygen, back to the heart for oxygenation. The standard BP of a healthy person is 120/80. So for our doctors to actually deem a person hypertensive, the person may have to measure above this 120/80. That is a person whose BP measures above 120/80. Let's say 130, 100, 140, 100 consistently. If this person's BP is checked for an extended period of time and the person is constantly getting these values, then they can conclude that the person is nearing hypertension or the person has hypertension. Factors affecting high blood pressure are: number one, genetics or inherited traits. I say this because studies have shown that if a person is born into a family who has a history of hypertension, the person is more likely to get it. Yes. Another factor is age. As we age, our risk increases. The risk actually increases after age 40. Another risk factor is also obesity. When you are obese or you have excess weight, you are also prone to hypertension. Physical inactivity or sedentary lifestyle can also elevate blood pressure. Sedentary lifestyle is where someone don't do much of exercise. Let's say I eat, I go into bed with no exercise involved. Yes, that's what we term as sedentary lifestyle. So physical inactivity or sedentary lifestyle can also contribute to high blood pressure. Stress, chronic stress can also elevate your BP. And smoking, those of us who smoke, please try and quit smoking. Smoking actually damages the blood vessels, thereby elevating blood pressure. Smoking damages the blood vessels. The blood vessels are the veins and the arteries that carry the blood to all parts of the body. Smoking damages these arteries and veins, thereby increasing blood pressure. So please do well to quit smoking. Another contributing factor is damaged kidneys. You know, the kidneys were created to filter excess waste and fluids from the body. Normally, people with damaged kidneys are not able to do this. Their kidneys are not able to function well to filter out waste and excess fluids. The kidneys are also there to maintain the normal acid base balance of the body and also regulate electrolytes like sodium and potassium. People who have damaged kidneys can't do this, thereby their BPs get elevated because there is always fluid retention in them. So that's how the kidneys also contribute to high blood pressure. All these I've talked about, the genetics, age, stress, smoking, and then obesity, they are all primary factors that contribute to high blood pressure. We are going to talk about the secondary factors too. The secondary factors are diet, certain medications, excessive intake of alcohol, and then hormonal imbalances. Yes, when we talk of diet, we can talk of high sodium diet but low in potassium, and then diet that contain too much sugar. Yes, high sugar content in diet can also let you have high BP. Certain medications like steroids can also contribute to that. And people with thyroid disorder, that is hormonal imbalances in some people, can also let them get high blood pressure. We have four types of high blood pressures. One is primary high blood pressure or essential high blood pressure. The essential one has no identifiable cause. We don't have any cause for this type of high blood pressure. The second one is secondary high blood pressure. The secondary one comes as a result of an underlying condition, underlying medical condition. So the first one being the primary high blood pressure or essential high blood pressure has no identifiable cause. But the second one, which is the secondary high blood pressure, comes as a result of an underlying condition, underlying medical condition. We also have malignant high blood pressure, and this one is severe and life-threatening. Yes, the severe and high-threatening type of high blood pressure is called the malignant high blood pressure or malignant hypertension. We also have pulmonary high blood pressure, and that one occurs in the lungs. The pulmonary one occurs in the lungs. So these are the four types of high blood pressures we have. One is the primary high blood pressure or essential high blood pressure, secondary high blood pressure, malignant high blood pressure, and lastly, pulmonary high blood pressure found in the lungs. We are talking about BP. This is something we always hear people talking about. We hear people dying from it. We even have a nickname for it. We call it silent killer because it doesn't really give symptoms. If it gives you symptoms today, then it should tell you that it's coming to kill you actually. So we call it silent killer. So we've heard a lot about high blood pressure, but what are some of the consequences we get when it's left untreated? So complications or consequences of high blood pressure. One of the consequences of high blood pressure is stroke. Yes, you can get stroke from high blood pressure if it's left untreated. Also, you can have heart failure, cognitive impairment, vision loss, or kidney damage. With the kidneys and how they work, I've explained earlier. So these are the complications you can actually get if you are on medications for hypertension and you are not adhering to the treatment plans. Please stick to your treatment plans and take your medications appropriately because hypertension is not something to joke around. It's a silent killer. It doesn't really give symptoms. Whenever it's giving you symptoms, it means it's coming to kill you. So please and please Do well to take your medications. Those of us who are already taking our medications, kudos to you. Do well to comply always. Please take your medications to avoid stroke, heart failure, kidney damage, and all that. I welcome all your suggestions in the comment box. Kindly like and share the videos. I hope you are all learning something today. And please, those who are joining us just today, kindly subscribe to this channel for me. Like I said, there are a lot of strategies we can employ in the prevention and management of high blood pressure. One is engaging in exercises. Exercises like brisk walking, skipping of ropes, yes, and also doing away with high sodium diets, foods that have high content of salt. Rather, we should consume high potassium diets. Potassium actually helps the heart to function well. We quit smoking, we do away with alcohol consumption, we monitor the BP regularly, and also adhere to our medications. But in all of this, you don't forget to go to a healthcare provider for proper diagnosis and treatment when you think you are having a high blood pressure. I hope you've all learned something about hypertension today. I thank you all for watching, and don't forget to take care of your heart for me. Remember, managing hypertension is a journey and not a destination. Until I see you in my next video, stay safe and take care of yourself.